And why do folks who have been chronically homeless, who also have serious mental health issues, die 10 to 15, 20 years sooner than the general population? If you're working with folks in prison, you're working with folks with executive function impairments. You're working with folks with major depressive disorders, people with ADHD or obsessive compulsive disorders, schizophrenia, bipolar disorder, people with personality disorders, folks with brain injuries, post-traumatic stress disorder. The majority of those clients are going to be dealing with some level of executive function impairment.
Welcome to the Managing Mental Health podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people that have overcome real struggles with mental health issues who can now share hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. We're back today with our very special guest, Dr. Jared Brown. Welcome back to the show. Thanks for joining us.
Absolutely. Thank you, Jamie, for having me back.
Absolutely. It was a pleasure last time. And for those that don't know, or if you're just joining us, this is part 2 of a 6-part series on executive functioning. So if you are just joining us, please go back and watch part 1, where we learned what executive functioning is, what it's responsible for, things like time management, memory, emotional regulation, even focus and communication. So we also learned about some of the causes. So one thing we're going to do in the series is each part we'll talk about a different aspect of executive functioning and see what we can learn from it educational wise, and also, how we can hopefully apply that to ourselves, to our loved ones, or to the clients that we work with in our particular roles. Today, we're going to look at the clinical and forensic considerations of executive dysfunction. So a lot of interesting questions come to mind when we bring that up. So Dr. Brown, just so everyone's clear on our direction and the topic, what do we mean by those terms, clinical and forensic, in terms of the field of psychology?
Yeah, so for me, my lens, the clinical, looking at it through kind of a mental health, behavioral health lens. So if any of you are working in mental health treatment, or folks with trauma or drug and alcohol problems, that's where I would look for clinical. Some folks may call clinical like more the medical field as well, depending on what lens you look at. And there's significant medical implications for this, which I know we're going to talk about later on in the series on how this impacts health and wellness, because there's plenty of research that shows that executive function deficits may actually play a role in obesity, or it may impact the management of type 2 diabetes and a bunch of other things. So we'll talk about that later, but hang on to that if you're interested in the kind of the medical, physical kind of health issues. When we talk about forensic, I'll look at it through kind of a forensic mental health lens, justice-involved populations, if you're working with folks on probation, parole in the courts, in the prisons. That would be the angle I would take with today's talk on that. And if you're working with folks in prison, you're working with folks with executive function impairments all the time. Almost everyone in prison probably has executive function impairments, and we'll talk about why that's the case today as well.
Okay, so yeah, a huge implication for the criminal justice system and working in those fields and those areas. Okay.
Definitely. And I know we wanted to start out maybe just a broad overview again, kind of going a little bit deeper if that works and stuff. But so again, if you're new to the series, again, executive function, boss of the brain, CEO of the brain, it guides the bus with day-to-day behavior. So if you know someone that really struggles managing their finances, they really struggle with cooking and cleaning, they have a really difficult time living independently without a lot of supports and services, those are really adaptive function deficits, practical, conceptual, and social skills. But what guides that? In a lot of cases, it's going to be executive function. And when someone has deficits in those areas, what could be going on? Well, maybe they're dealing with working memory deficits, which is a component of executive function. Think of working memory as your brain's post-it note. It's almost like a mental workspace. So if you go to the grocery store, you forget your list at home, our working memory kicks in. Most people can keep track of a few things in their working memory without writing it down. But for some clinical and forensic populations, if you ask them to multitask or do a whole bunch of things at once, their working memory shuts down a lot of times and they can't
Mm,
do that. So treatment providers, if someone's going to treatment and they have these deficits in a treatment setting, and that treatment facilitator is talking really fast, maybe there's a lot of background noise in the group, other group members are chatting on the side, or someone's getting up answering their phone,
mm,
that client's working memory is going to be so overwhelmed and they're going to shut down. They're not going to be able to take in that information. And if a treatment provider doesn't recognize that, it could look like the client isn't paying attention or doesn't want to
mm.
be there, when in fact their brain is just on complete overload.
Right.
Another big component of this that has significant implications for justice involved populations is going to be inhibition.
Hmm.
We spoke about that in the first section, but when inhibition is working properly, that is our brain's parking brake. So we all get stressed, we all get anger. Anger sometimes comes up. Good inhibition helps us slow down, pause, and reflect.
Hmm.
A lot of folks end up in the criminal justice system because they're dealing with disinhibition, which is basically self-control deficits, impulse control problems. They might be more likely when they get really mad to start getting into fights, domestic violence, road rage. It can come out, if you really want to dig into this, it can really come out sideways in clients in terms of their eating patterns.
Mm,
Clients with really low disinhibition may overeat. They may abuse sugar, caffeine, alcohol, drugs. They may have a shopping addiction, sex addiction,
hmm.
internet gaming addiction. So look at your client's lifestyle and some of those areas. If they're really struggling in those areas, it may be related to disinhibition. So their parking brake in their brain isn't working properly. And if that's the case, they're probably not appreciating future consequences. They're
Uh,
really living in the moment. They're not thinking about tomorrow or how their actions impact them or other people. And then
yep.
the other big component is cognitive flexibility. And when I give talks on that, look outside like during a windstorm and the trees branches are moving back and forth. That's good cognitive flexibility where we're more adaptable, we're more flexible. If you have a client that has cognitive inflexibility, they're really stiff, they're rigid. It's there where the highway. They could come off very stubborn. They lack adaptability. People who are most successful in life typically are more adaptable. They can go with the flow. They can handle change. They can handle disappointment more effectively. People with cognitive inflexibility problems aren't going to handle those things too well.
Mm.
Those are the big three areas of executive function. There's many more, but just to give you guys an overview, that's a good starting point, I think.
Yeah, and that's a lot because I think we take a lot of those things for granted sometimes in just normal everyday life. And like you mentioned, if you, especially if you've got a certain population like those involved in the criminal justice system, those in prison, they're, I mean, you can almost draw a straight line from behavior to, at some point, a lack of understanding or a lack of ability to think about future consequences. So definitely in terms of the inhibition control, and then the cognitive flexibility too, in terms of, I can see how that would definitely play a huge part in someone just, coordinating their daily activities, like you mentioned already, in terms of just making regular everyday decisions. And I can see that also affecting, what you said, we'll get into the medical side too, but like if a person has medication they're supposed to take every day and they might forget to take it, or can't remember if they took it already, or, things like that, or when is their doctor's appointment, all of those areas, I think can be affected.
That's a very practical example that I've worked on cases where maybe that client's on 20 medications per day,
Hmm.
and someone with executive function impairments has all these bottles of meds, and it's just so overwhelming.
Yeah.
What do we do about that? A med box, an in-home nurse, someone that can come in and set up their meds every day in the box.
Yep.
Those are just really practical things. You can apply that to so many things, but that is a classic example of how executive dysfunction can really play out. And if that client stops taking their meds and maybe they have schizophrenia or bipolar disorder, or maybe it's a chronic medical condition and they need medications for type 2 diabetes, you can about imagine what happens if they go off those meds. Things spiral out of control quickly.
Yep.
And it can spiral out of control, going to the hospital, becoming homeless,
Hmm.
becoming more erratic and disorganizing your behavior that scares other people. They don't know what's going on. And 911's called and crisis is called. And the list goes on and on and on.
Yep. You mentioned the homeless population, and that's a huge. I remember in our master's program, some of the research and work we did there. There was some stuff I remember reading about how it's so prominent that when clinicians start working with someone that's homeless, that they're not on the right medications, or they don't have the medications, or they used to be and have quit taking them. And so it takes an issue that could be manageable, but possibly because of the executive dysfunction, it just becomes overwhelming and exacerbates that condition that otherwise would have been, being positively effective. Now it's a negative effect, which only makes the whole situation worse.
Well, that's a nice segue into the clinical realm, because I've done a lot of talks on homelessness and poverty, and
Hmm.
I've consulted on many cases where that client has had chronic long-term homelessness. And when we're talking about folks who have been homeless for a long, long period of time, the research is very, very clear. Histories of head injuries are through the roof,
Hmm.
medical comorbidities, sleep issues, dietary issues, dental problems. You got to be aware of heat strokes, joint pain, gut
Hmm.
health issues. I mean, the list goes on and on and
Yeah.
on. And why do chronic folks who've been chronically homeless, who also have serious mental health issues, die 10 to 15, 20 years sooner than the general population? All those things I listed off, including many more.
Yeah.
And executive dysfunction is a big variable in there that really gets in the way of that client getting out of homelessness. Because what happens if that client's homeless? They're required to fill out paperwork. They're required to get a
Hmm.
job if they're on probation. They're required to find stable housing. If they have all those medical and psychiatric issues going on top of executive function, filling out paperwork's a nightmare.
Hmm.
Forgetfulness, time management. I mean, the list goes on. And most folks who are homeless chronically are not getting a good night's sleep.
Hmm.
What's one of the worst things for executive function? Chronic sleep issues. It's fuel
Hmm.
on the fire. And people with profound executive function impairments also don't sleep well. So it impacts it both ways. So
Wow.
combating executive dysfunction really requires a holistic, integrative approach. And part of that is eating healthy, exercising, getting better sleep. And those are huge challenges for people who are chronically homeless. It's huge challenges for people who are in prison too. I mean,
Hmm.
that's a whole nother can of worms to take into account there as well.
Yeah. Yeah. I can imagine especially in in the clinical area. If you're trying to do like a homeless shelter, like a sleep shelter, where you have people, you come in, you're providing a warm place to sleep, a place in the dry, a bed, but you have now you have a whole group of people, 15, 20, 40 people all in the same place, and the odds of any of them, if not all of them, having executive dysfunction, having uh, probably off of medications, sleep issues, like you mentioned, all these things that could just turn into a nightmare. Trying to, you know, trying to find a way to help the issue, but there's so many variables that need to be addressed.
I gave a talk on the topic of sleep issues and homeless shelters a couple years ago, and there's been a lot of studies that just look at that one variable. And as you
Hmm.
can imagine, those settings are kind of noisy.
Hmm.
The lights are bright in a lot of cases. A lot of times they're in parts of the city where there's a lot of noise and doors are closing and city work is going on. That's what the research says in a
Yeah.
nutshell. And homeless shelters would benefit, and this is according to the research too, to really become sleep informed and really set up their facility as much as possible to help these individuals get a better night's sleep on top of a million other variables. But
Yeah.
that would be one practical area. If you're listening to this and you do work with homeless populations or you're working in a homeless shelter, really become familiar with that research and learn some of those basic principles because, in my opinion, sleep is number one to health. And it's going to help people with executive function impairments improve functioning. So
Hmm.
maybe someone's asking yourself, where do we start? My opinion, I could be wrong on this, start with sleep. What's
Hmm.
good for someone for their sleep health is usually good for the rest of their body. So it's probably going to help their brain. It's probably going to help their gut. It's going
Yeah.
to help their mood. It's going to help their energy. So maybe starting with sleep improvement strategies as well, which I'll talk more about that in future episodes too.
Okay. All right. Good. Good. Yeah. Thank you for that. That's definitely a good pointer for anyone working in those fields. I know when I worked in the domestic violence field, we had an emergency shelter, and it included, rooms and bunk beds and things like that. And it was very easy to see that, if a person's already in the middle of trauma, if they're already in the middle of these circumstances that are stressful and sometimes dangerous, and that, you know, just not even sleeping well just makes it worse, where they can't think, can't make decisions, or just tired physically and mentally. So yeah, it's absolutely an important first step of the process to look at.
And that's a great segue into the clinical trauma
Yes.
realm too. There's a ton of research on working with survivors of intimate partner violence
Hmm.
as well as perpetrators. And the research says both perpetrators and survivors typically are going to be dealing with more cognitive impairments, more executive function impairments. And anytime you're working with somebody that's had horrific traumas happen to them, they're probably not sleeping well. They're probably more anxious. They're more depressed, which all impacts executive function.
Hmm.
How often do domestic violence shelters really take into account executive function? I don't think a lot. There's probably some out there, but I've given enough talks to different domestic violence programs, at least the ones that I've talked to. It's
Hmm.
not on their radar, even though there's just numerous studies that point to the fact that a very high percentage of these individuals entering these facilities have also had histories of head trauma, strangulation. I mean, that's a whole nother
Hmm.
can of worms. If you're interested in the topic of traumatic brain injury, strangulation, domestic violence, Google my name. You'll find an article I wrote on the national level in the United States on that very topic. And
Okay.
all of that impacts executive function without a doubt.
Okay. So, what are some other clinical considerations then for executive functioning in terms of what to look for, what to do about it?
Well, practically speaking, when you're working with folks who have executive function impairments in a clinical setting, not everyone's going to present the same, but a lot of times they're going to become more easily fatigued. So look for inconsistent energy patterns.
Hmm.
Higher levels of irritability are going to be common. Depression, concentration issues. It could set up that client to being more prone to accidents, slips and falls, things like that. Look for patterns of impulsive decision making. Executive dysfunction can also contribute to more self-doubt and shame issues. And the reason why that is, maybe the person doesn't realize they've had a head injury or something and they're dealing with executive function impairment, and they just make these same mistakes over and over and over again.
Mm,
No one's ever educated them about that. So the client now starts thinking, I'm not that smart.
right.
Why even try? And that gets to their core self-esteem issues, self-worth,
Hmm.
self-efficacy. The more you can educate clients about this, it provides an opportunity to release some of that. I've seen where the client realizes, well, it's not my fault. I'm not stupid. Or they have these thoughts pop in, but you educate them about it. Now they can do things about it and realize, it wasn't my fault. You might see more avoidant behaviors, higher levels of fear reaction, procrastination, self-defeating behaviors, and
Hmm.
cooperation issues as well from a practical clinical standpoint. By no means am I saying if you're working with a client who has these things going on, it's executive function impairment. But the more of these things going on, it really should alert you. Start looking through an executive function lens.
Hmm.
If you're wrong, it doesn't really matter because executive function based interventions are good for anybody. Things
Right.
that are practical, coaching, modeling, teaching, slowing things down, exercise, eating healthy, getting good sleep. That's good for any human being, regardless of their background, their diagnosis, or anything like that. But
Hmm.
the research is pretty clear. If you're working with folks with major depressive disorders,
Hmm.
people with ADHD or obsessive compulsive disorder, schizophrenia, bipolar disorder, people with personality disorders, folks with brain injuries, post traumatic stress disorder, and I could go down a long list. Research shows the majority of those clients are going to be dealing with some level of executive function impairment. So the takeaway point is if you're working with any clinical population, start becoming executive function informed because most of your clients probably are going to deal with some deficits in this area. Maybe it's
Hmm.
mild, maybe it's moderate, maybe it's severe, maybe it's inconsistent. One day they're a little more with it, the next day they're off. Why might you see those roller coaster rides of executive function impairment go from pretty manageable to profound? Well, high levels of stress. If
Hmm.
someone's using drugs, if they go off their meds, if they got no sleep the night before, if they're watching 8 hours of screen time and laying around all day long and they're dehydrated, that's you can see variables in all of our executive function. So what we think
Hmm.
about, who we associate with, what we do, all impacts this without a doubt.
Yeah. It sounds like looking then through at this executive function lens, um, like you said, could lead you to help in areas of just like daily functioning, but also since it's pretty much coexisting with something else, it could highlight that the need to dive deeper into another area like, okay, well, is there an ADHD diagnosis? Is there a depressive disorder diagnosis? And that could tie the or connect the dots between a lot of issues like we already mentioned in terms of like taking medicine, going to appointments, you know, just regular life functioning, because yeah, they may not be, especially as the person involved, the client, they may not be putting the two things together.
Definitely not. And there's a case, like I'll give you a classic case example. There's a case I consulted on a few years ago. It was an adult female, high IQ, On paper, really high IQ, but she always struggled in school. She got bullied and teased. Her parents would even put her down. They just, why not try harder? Why are you being so lazy?
Hmm.
Well, over time, as she became an adult, she got the official diagnosis that she was dealing with some cognitive impairments, profound executive function impairments,
Hmm.
but the IQ score made it look like to other people, "Well, she's just being lazy. She's doing this
Uh,
intentionally." We talked in the first one, IQ scores, high IQ scores don't necessarily always protect people from having executive function impairments. But if you have a very low IQ and you're working with clients with like a neurodevelopmental disorder, they're always going to have some level of
mhm.
executive function impairments. And this adult client got easily fatigued. So around other people, she got labeled as lazy because she just was so tired all the time. And this got
Mhm.
in the way of motivation, inconsistent performance where she could do it one day, the next day she couldn't. She was so disorganized in her thinking, just
Mhm.
scatterbrain everywhere. That's a red flag indicator of executive function impairments as well. And this really trickled down into difficulty living independently without support. And this client said what helped her the most is the people around her really took the time to understand her, to be patient,
Mhm.
to not overwhelm her with a bunch of words, avoid multitasking, using a label machine, getting things really organized. Because someone with executive function, their brain can be just really scattered.
Uh-huh.
And a good example would be go to their house, look inside their car. If they're at school, look inside their locker with permission. If
Mhm.
those areas are just in complete disarray all the time, that's probably an indication of how they feel in the inside of their brain.
Yeah.
I have a family member who's a lovely individual, great communicator, wonderful to be around, but her apartment is in disarray all the time, no matter what. Profound executive function impairments.
Uh-huh.
Those are just things to really get a snapshot into that person's inner working brain.
Mhm. Yeah, and I love the fact that you stressed that uh, a good IQ is not, you know, not the end all do all of this issue. That you can have a very intelligent person, and they can still have some sort of executive dysfunction going on, and it could be from, as a part of ADHD or something like that, or it could be from a brain injury. I know, like you just mentioned, I know someone very well that is super intelligent, and but if you look in their car or their house, you're immediately, wanting to sign them up for an episode of Hoarders. Almost, it's bad sometimes, and it's kind of become a running joke with all of us that are in this circle. uh, but yeah, the guy himself's very intelligent. I mean, can discuss any subject, but tends to have that disorganized thought and life pattern sometimes.
Mhm. Yeah, profound. And if you segue into working with offender-based populations or whatever term you want to, justice-involved individuals,
Yes.
the research is very clear on this. The overwhelming majority of those individuals will be dealing with some level of executive function impairment, and it trickles down into planning deficits,
Hmm.
staying organized, problems with self-monitoring, which is basically a reduced ability to monitor our own self, our own thinking, our own actions, our own behavior.
Hmm.
Disinhibition is through the roof, so self-control deficits, cognitive inflexibility problems, goal planning, achievement, all of those things. I used to work as a parole officer back in the day, a long time ago, did house arrest work too. I didn't know anything about executive function. If I could go back in time
Hmm.
and apply what I know now, there's a lot of things I would have done different. There's so many people that get involved in the criminal justice system with these issues. And unfortunately, the criminal justice legal arenas don't have a lot of training in this. So
Hmm.
then once that person gets involved in the justice system, A lot of times it's a revolving door where they go to court, they get sentenced, they go to jail, prison, they're back on probation, they have a probation violation, they're back to court over and over and over again.
Hmm.
Why might that be the case? Most people with justice involved histories have head injuries, over half. Most have trauma histories. Most are going to have executive dysfunction. So let's say someone's court ordered on probation. Most people on probation or parole are required to get a job,
Hmm.
keep a job, find housing, stay medication compliant. Sometimes they're required to go to treatment. If they have a disorganized brain and they can't plan and they can't fill out forms that well and no one's helping them, but the court
Yep.
says, hey, here's some forms, fill it out.
Yep.
Technical violation. They miss their probation meeting because they just get time mixed up. Probation officer just assumes the client is doing it intentionally, but maybe
Hmm.
it's a brain-based impairment. And that is part of the revolving door. Once they get in, it's hard to get out without having an executive function informed approach. If
Hmm.
any of you are working in anger management or with violent offender populations, plenty of research shows that executive function impairments may play a driving role here. Why is that the case? Well, as we are learning, executive dysfunction can impact problem solving abilities. We have more self control deficits. We might have more mood problems where we get really angry and we go from 0 to 60 in a second, where that person gets so mad and ends up punching somebody. They're not connecting the dots there,
Hmm.
that if I do that, I'm going to get arrested maybe. That's an abstract reasoning deficit as well, where abstract reasoning relates to seeing the forest through the trees, planning for the future, connecting my actions now to future consequences. And it also relates to understanding how and why questions. Another tip, if you're a treatment provider, you have a client with all of these questions, all these issues going on,
Hmm.
and you ask that client a bunch of how or why questions, and they have profound executive function impairments, that's going to be tricky for their brain to answer those questions. So insight-based therapeutic approaches may not be most appropriate for some of these clients, even though they're court ordered to go to therapy. What would be better in those situations? Working with a case manager, a skills worker, someone that can really show them the skill and practice it and coach it and model it and teach it.
Hmm.
Therapy is wonderful, but it needs to be paired with concrete reinforcement, not just in that office setting with a therapist for an hour, because that client could really mask their deficits in there really nicely,
Hmm.
be really articulate, and give the verbal head nod. Yeah, I know exactly what you're talking about, even though they may not have a clue what was being said in there.
Hmm.
The minute they leave that therapy office, get on the bus, go back home, it's in one ear out the other a lot of times. So they need to learn it in that setting, but then it needs to be paired with like a skills worker who can work in the community or in the home with them. That's the best plan of attack.
So, what would just real quick? What would be an example then of the how and why question?
Tell me how you feel.
Okay.
Why did you do that?
Uh,
Self-reflection could be impacted. Clients with neurodevelopmental disorders have the cloak of competence a lot of times, where if you ask a bunch of yes questions too, they may give the verbal head nod. You need to fact check. You need to verify.
right.
Some of these clients may have auditory processing deficits as well, where the therapist, counselor, whoever it is asking questions, but that client's brain is not processing that information effectively.
Hmm.
They may also have something called information processing deficits, which is a profound deficit associated with executive function. What might that be? It's a traffic jam in our brain. So I have a profound executive function. I'm going to you, Jamie, for therapy. You're you're giving me all this great information. You have great intentions. You're
Hmm.
talking really fast, but my information processing speed is slow,
Hmm.
and I can't take in all this information. So my brain shuts down. Maybe I start fidgeting more in there. Maybe I'm standing up more. I'm getting more distracted.
Hmm.
There's a case I consulted on where I saw this. It was a profound case. You would ask the client a question. She would literally sit there for 45 seconds to a minute. If you didn't know what was going on, you would assume the client didn't hear you
Hmm.
or was just didn't want to answer your question. I knew from the records the client had profound information processing deficits. You just sit back for a minute, be okay with silence.
Uh-huh.
She eventually responded just fine, but her brain needed that extra time.
Hmm.
How often is a courtroom set up like this or a law enforcement interaction? Never.
Never,
You're
never.
going quick, 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 quick.
Yep. Yep.
And the clients in there, they don't know what's going on. So a lot of times the judge asks, do you understand your rights? Or the police officer, do you understand your Miranda rights? You bet. I had no clue what they just agreed to.
Right.
So what do we got there now? Miranda right comprehension issues. Maybe there's a
Hmm.
false confession. Maybe there's wrongful alibi. It could be a list of things. So those are a few forensic legal things to consider too, how it can really trickle down and impacting that arena as well.
Yeah, I think and there's a lot of historical discussion to this, which we won't, we wouldn't dare have the time to get into on a short discussion. But I think our legal criminal justice system has been based solely a lot of times on morality, which is confused because even if you ask someone that has committed a crime, say, well, is this crime wrong? They'll go, yeah, yes, it is. But there's something else at play there. And like you said, with the executive dysfunction, they may have an inhibition issue to where their brain just doesn't process the consequences of the actions. And in that moment, there seems to be this immediate need for whatever this behavior is, whether it's some sort of, lashing out like a violent type issue, whether it's making a certain choice, and they can't understand or process the future consequences of that action. And it is just confusing for the people in the criminal justice system because they're only looking at it from a morality issue. Oh, you did something that you knew was wrong.
Got a classic example of that. So I've consulted on a few theft cases where the client had a neurodevelopmental disorder
Hmm.
and the topic of morality definitely comes up there, but they had profound executive function impairments
Hmm.
and they didn't understand the concept of ownership, where they didn't understand you go into a grocery store and you open up a candy bar and you take a couple bites from it or you drink half a soda. I mean, that is theft.
Yeah.
Another example with this theft example, somebody took something from someone else's house, but they didn't connect the dots because that person left the object out in an open space. So
Mm.
their brain said, okay, it's in the open space now. There's that cell phone. It's just sitting there. Oh, must not belong to anybody now. I'm grabbing it. That's a perspective taking deficit.
Hmm.
Could be an executive function impairment. It could be
Hmm.
an abstract reasoning deficit. It could be some level of gullibility or naivete where someone
Hmm.
else kind of said, hey, you should just grab that. That
Right.
belongs to you. And their brain's not connecting the dots. So there's some boundary confusion here issues too. So
Hmm.
executive function's not the only variable, but it is a big piece of that puzzle
Yeah.
with any crime too.
Sure. Yeah. Because with any crime, there's going to be some thought pattern that is not, you know, correct and definitely not tied to consequences. Most, I would say, you know, a huge majority of the time. Um, okay. So, and you mentioned like, um, working with clients in this forensic perspective, giving them the time they need, noticing cues like body motion or speech, things like that, asking how and why questions, not just yes or no, so more open-ended questions. Are there any other considerations in terms of the forensic work that we could, or that that people could be aware of?
Well, I think it can be applied to anything, but from an intervention lens, practicing it over and over again,
Mhm.
coaching the skill, modeling it,
Mm.
role
Yeah.
playing, making sure it's developmentally and emotionally appropriate, because also often when you're working with a clinical or forensic population, maybe on paper they're 20 years old, but they might have a brain of a 12-year-old or a
Mhm.
15-year-old. So are you developing the intervention to match their chronological age, which is not good, or to really match how their brain is functioning? Being aware of the vocabulary you're using as well, making sure it matches that client's level of understanding, not to go down a rabbit hole, but over 60% of people in prison, according to some studies, may have undiagnosed dyslexia. I have a
Mm.
graduate certificate in dyslexia. I've actually given some talks on this too. What happens if your client has undiagnosed dyslexia or some sort of learning disability? Another big variable to take into account here. Be aware of yes or no questions, because that can mask the client's true comprehension. So fact
Mhm.
check, verify, be aware of those information processing deficits we spoke about when possible. Slow down, don't multitask, give one question, one directive at a time. Maybe pair it too. Some of these clients like music therapy, art therapy, animal assisted therapy.
Mhm.
Go for a walk with the client. Walking seems to help the brain take in information better than
Mhm.
maybe just sitting there still, standing and looking at each other.
Yeah, that's a great point. Yeah, definitely the physical component of that, just walking helps regulate your nervous system. So it kind of relieves some of the pressure, so to speak, on the brain so that, it's
Yes.
easier to think and easier to comprehend. But yeah, and I like the points of using the other therapy modalities in terms of art, music, pet, lot of practical uh, examples of pet therapy between dogs, horses. All right. Well, wow. There's so much to this. It's amazing, and there's always so much to learn. But it's good stuff. Stuff that the more we learn, hopefully, and especially for professionals, the more we can start putting into practice and making a difference in the jobs that we do and the people that we're helping, and hopefully to build you know improvements long term, so that we can do a better job and helping people get them what they need. So thank you very much, Dr. Brown, for covering all this with us, and definitely looking forward to the rest of the series. Everyone, you can join us next time for part 3 of this amazing 6-part series on executive function. We're going to talk next time about the physical health implications, which I have a lot of questions. I want to hear what you have to say about that too, because I know that's also one of your specialty areas. So I think we'll get a lot out of that. And everyone, you can find a list of each episode, in the description. And Dr. Brown, thank you very much for joining us again. And everyone, please subscribe, like, comment, and share, and stay connected to this community of mental well-being as we all learn and grow together.